Good morning, everyone. My name is Amy Pilotte, and I am a nurse practitioner focusing on the care of cancer survivors and breast care, where I work at Brown Surgical Associates and also at the Women's Medicine Collaborative of Lifespan. Gloria Gemma, our wonderful resource for breast cancer patients, asked me to make a video to discuss some of the crazy changes that are going on in our lives every day as a community with the COVID-19 crisis. So before I start, I just wanted to make sure that you know that anything that we say over the next few minutes together doesn't replace medical advice from your physician and your provider team. So any questions about your individual care, please do reach out to your team so that they can help you with your individual needs. Now that said, I wanted to let you know that our offices for Brown Surgical Associates and the Women's Medicine Collaborative are open and are seeing patients. There may be some limitations. We may be advising some people to reschedule, but I would encourage, if you have an appointment, to reach out to your team to talk about what's best for you. We are doing what's called telehealth visits now, so we are able to do confidential video calls with patients who don't need to be seen urgently, and we will have dedicated time to talk to a patient about how they're doing, any questions that they have through this telehealth visit. So I would encourage you, if you're interested in that and you happen to have a routine appointment or have any concerns, to please call your provider through Brown or Lifespan to see if this is an option for you. And we're happy to do those during these trying times where we're really recommending that people who can stay at home do stay at home. I wanted to take a few minutes to talk about different things like scheduling. So for example, for routine visits like screening mammograms, so say you're somebody who has your routine annual mammogram coming up in the next couple weeks, that may be rescheduled. So as of right now, what we know from major imaging centers that we work with a lot, like the Ann Pappas Center for Breast Imaging, Rhode Island Medical Imaging, they are not doing routine screening mammography, and this will be rescheduled, but they are still doing what we call diagnostic imaging. So if we're working up a problem, if somebody presents with a new breast lump or something like that, we do want to hear from you and we do want to help you. So please reach out to us in that case, but know that if you're doing great and you're, say, 3 years out, from your cancer, your doctor may recommend that your appointment be rescheduled, but go ahead and reach out to your team. I wanted to take a minute to talk about the emotional toll that we might all be experiencing these days with the rapid change of information, these really scary times that we're in. And this may bring some challenges back for people who have had a cancer experience. So I'd like to touch base about that and review the importance of your self-care during this time. There are silver linings with things, and even though we're all recommended to be home as much as possible and do the social distancing protocols, we are in a time where we have great technology, so we can still, in some ways, connect with people if we're feeling more anxious or if we're feeling down. Some people have access to FaceTime or Zoom. Also, things like getting outside and going for walks with your family members can be very, very helpful. There are so many resources now that are being provided for free through the community, like online yoga classes. There are apps for meditation like Calm or Headstrong, and so many people are coming forward to offer these types of resources free for people during this crazy time. Even local gyms, your gym or another gym in your community, or even if it's not in your community, you can go on YouTube and have access to great exercise classes in a time where we can't get to the gym, for example. So if you're somebody like me who really values group exercise, I have been able to maintain some of that through doing a Zoom video through a group of women that I really rely on to keep us moving and keep those relationships going and exercising. One thing you might notice is that you might find your sleep is a little bit disrupted during this time. I've personally found that the news can really raise the anxiety level for a lot of people, including myself. So I have found that not watching the news before bedtime, and really even after I get home from work, is more helpful for sleep. Not scrolling through your phone and technology in the hour or two before trying to relax and go to sleep can be helpful. Please be mindful of your nutrition. The candy jar has been staring at me more lately than it has in the past, and we all can have this stressful eating time. So really trying to focus on your nutrition, continue on your plant-based diets, avoiding excessive alcohol use. So really minimizing alcohol during this time, and all the time as well can really be helpful. Just know, please, that we are here for you. Every day is a new day for us, like it is for you. And if there's any concerns that you have, please do not hesitate to reach out to our office or your providers. And we are all in this together. Thank you.